Hi, Nathan Ritter from cardiogauge.com. I'm a cardiologist in New York. Let's talk about eplerenone. Okay, so eplerenone is a relatively commonly used heart and blood pressure medication. I find it super useful, underrated, well tolerated, generally inexpensive, and a nugget better than spironolactone for men as compared to women. And it's a top 10 heart medication. So how does it work? It's an aldosterone blocker. Aldosterone is a naturally occurring hormone. It is squirted out by the adrenal glands, which sit on top of your kidneys, and the aldosterone molecule floats around and it binds the aldosterone receptor, which is found in a lot of places, but probably most importantly, the brain and kidney. And so when aldosterone binds the aldosterone receptor in the kidney over here, the kidney holds on to sodium, it holds on to water, and it squirts out potassium. So aldosterone binds the receptor, and then the kidneys make it so you're holding on to salt and water. Over in the brain, the aldosterone molecule binds the receptor, and it, believe it or not, it makes you more thirsty, and it makes you crave salt. Super interesting. So the brain makes you behave and go get more water and get more salt, and over here in the kidney, the salt and the water are held on to. So that results in an increase in your blood volume, and then increase in blood pressure and a decrease in potassium. And so why would aldosterone exist at all? Why would we even have it? Well, way back in the old days, aldosterone helped us survive when water and salt were scarce. No water, no salt, all dragged out. Ooh. Aldosterone saves the day and helps us stay hydrated and have enough sodium in our bodies. But these days, we have as much water and salt as we want. We have the water faucet to give us water anytime we want it. We got Vicky salt and pepper chips, Chinese food, all the salt we could ever want. So we don't really need as much aldosterone. Hence, aldosterone blockers. And so with eplerenone, obviously, eplerenone goes in, it binds the aldosterone receptor here, and then it blocks the effect of aldosterone, which can't activate the receptor. So the result is obviously the opposite of aldosterone's effects, with decreased blood volume, decreased blood pressure, increased potassium. So we'll go into the effects. So we'll go into the uses, dose, side effects, etc. It's used in heart failure, so both heart failure with a normal ejection fraction and heart failure with a reduced ejection fraction, where it can decrease death 10 to 15% and decrease hospitalization around 20%. It's also used in high blood pressure. It's usually a third or fourth line choice for blood pressure management, and it can decrease your pressure 5 to 10 points over 4 points, something like that. The dose is 25 to 200 milligrams per day. By far the most common dose is 50 milligrams per day. Side effects. It causes increased potassium in some people, so if your potassium goes up to 5.2 or more, the dose might get reduced or might get stopped. The potassium would be rechecked to make sure that was a real value. First though, it can decrease kidney function. Generally that's a temporary thing that resolves with stoppage. So that's why blood test monitoring is done. And it can cause dizziness and lightheadedness like any blood pressure medication. How's the monitoring done? There's a blood test. The creatinine and potassium are done, say 1 to 2 weeks after starting it, and then every 6 to 12 months thereafter. Basically, you should have a blood test once a year if you're on eplerenone. The cost, it's generic, so unfortunately that doesn't always mean cheap, but it's quite variable. With insurance, it can be quite affordable, but if you're paying cash, like for example at Walmart, I just looked this one up, it was $90 for 90 days, which I consider pretty pricey. At Cost Plus, $30 for 90 days. And then if you get a coupon, you can go to Walmart and get it for around 30 bucks too. But the coupons are rough because you never know what you're gonna get, and it can be kind of hard to manage. So I prefer pharmacy like Cost Plus, where you know what you're getting. You just pay, you don't need any coupons, and that's a cash price. And then this nugget here, spironolactone and eplerenone are both used for heart failure and high blood pressure, but spironolactone, importantly, has anti-androgen effects, so not so great for men in a lot of respects. It's like taking a medication that decreases the effect of testosterone. It can block the effects of testosterone. So that generally makes men feel fatigued and have erectile dysfunction and depression. So spironolactone is awesome for women because they don't need a lot of androgen. And this is shown in data that where